kasabugan singit na muadto sa imong paa. AVN, also known as bone death. The bone literally dies. The blood supply is affected. That's why it's called osteonecrosis, avascular necrosis, or bone death. Why is this a hidden crisis? It's because 60% of hip replacements are caused by AVN in Asia, compared to Western countries where it's arthritis in elderly. Just a representation of what osteonecrosis or AVN can be. This is AVN of the hip. And the bone dies, literally dies. Moving forward, when the blood supply is affected from a normal hip, the bone will slowly die. That is why from a normal round spherical na hip joint, it becomes really flattened. That's what you see there. That's AVN. Again, groin pain, limping, stiffness, and unable to do a figure of 4 are some of the symptoms. 60% of Asian hip replacements are caused by AVN. Average is around 38 years old. My youngest patient is actually about 20 years old. We can prevent this, but we need to be aware. We need to share the awareness of AVN. That's why early detection is key. If you have an x-ray of a normal hip, you can see how round it is, and it's round. The head is very circular, both left and right. Compare the normal hips to this one here where you have deformity already. That is grade 4 AVN with corresponding or secondary arthritis. Nag-arthritis na ang both hips. Remember, I hope you saw it. I hope you understand na when you have AVN, a lot of this, more than 90%, are misdiagnosed. Some people will think about it as muscle strain in the groin, and there's an average of 5 years na delay in diagnosis. That's why majority of the patients can no longer be saved. From a normal hip, it dies very quickly. From a normal hip that is round, the AVN becomes deformed. Here is both a left and a right hip, showing you the difference from a normal hip and a hip with avascular necrosis that is stage 4 already.